Namaste, guys. I am Dr. Anushruti and I'm back with an energetic episode. Athletic training encompasses the prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute, or chronic injuries and medical conditions. So, to discuss all of this, I have an athletic trainer himself. Today on board, I have Dr. Marco Nunez. He is a doctor of athletic training and sports injury rehab therapist. He is joining us live directly from Los Angeles. Hello, Dr. Marco. How are you?
Good, I'm doing well. Good morning. Welcome, everybody. Great to be here. Thank you for having me.
Thank you so much. Well, you specialize in athletic training. So, what exactly is the role of an athletic trainer in athlete's life?
So the role of an athletic trainer has actually evolved over the last 20 years. The old traditional athletic trainer, whenever you see an injury that happens during a sporting event or even nowadays a dance event or anything like that, the lady or the gentleman that kind of runs onto the field to examine the acute injury that happens on the field tends to be an athletic trainer. So the traditional setting is that we usually attend to immediate injuries when they do happen. We assess them. We determine whether they need to be immobilized. What's the capacity of the injury? What's kind of the first responders what we need to do to try to assess the injury and treat it on site. Now, but that's kind of been the traditional. We still do that, but over the last 20 years, the athletic trainer has evolved to the sense of also involving a little bit of rehab, injury prevention, strength and conditioning as well, and even a little sports science in there as well. Because at the end of the day, it's funny because I refer to myself as a performance athletic trainer, not just a traditional athletic trainer. And the reason being is that my job as an athletic trainer is to help the athlete perform on the field, on the court, or wherever they need to be. And that also involves nutrition. That also involves a little bit of strength and conditioning. That involves a little bit of injury prevention and even sleep, anything of that sort. So majority of the times, the athletic trainer is the individual that's with the athlete majority of the time. Wherever the athlete goes, wherever they travel, the athletic trainer has to be with them.
You said it has evolved in injury prevention as well. So,
correct.
Being an athletic trainer during injury, at the time of injury, what is your approach towards that? Like, what is your basic beginning of a rehab session? And specifically, when the athlete is on ground, when he's performing at that particular time, how do you manage to make him more, able to just go back to the field again? Like, I believe that is going to be a very tough job, and of course, a pressurizing job that you have to make that athlete comfortable and move him back to the ground. So what is your approach towards it?
Yeah, so one of the first things that we do at the beginning of the season, we do what's called injury assessments or pre-injury assessments or risk assessments. So at the beginning of the season, we perform a variety of different assessments to try to identify either one, if the athlete is at risk of injury based on a percentage, whether it's the ankle, the knee, the hip, the shoulder, and the part. And then what we do, we create a program for them to try to help reduce the risk. Now, as an athletic trainer, physical therapist, or anything of that sort, obviously we cannot stop from injuries from happening. Injuries will happen no matter what, but our goal is to try to help reduce the risk of that athlete injuring, whether it's an ankle, whether it's a knee type of thing. Now, the other reason why we do these pre-season assessments is to try to determine if an athlete is healthy, what does their ankle look like? What does their stability look like? What does their range of motion? What does their strength look like at the beginning of the season? So if they do end up with an ankle injury, then now we have what we call a baseline. So the athlete's like, hey, this is what you look like when you were healthy. Now you got injured. We got to try to get these numbers back to where you were at the beginning of the season. That at least tells us, hey, you know what? At least you're back to where you were before the injury. Now we feel comfortable enough to put you back onto the field and say, okay, now your risk of re-injury is lower. Does it mean they're not going to re-injure it? No, it doesn't. But all we're doing, we're playing with numbers. We're trying to reduce the risk, the percentage of the chances of them re-injuring it or just causing an injury type thing. So having the baseline number is great to have as a reference to say. It's almost like when you have a fever, right? Your normal temperature is what, about 98.6 degrees, 98.6 degrees. So you have fever, you take your temperature. Okay, now it's 100. Now it's 99. Oh, that's back to normal. Okay, now you can go back to school. You go back to work because now that's your baseline. So that's kind of like the reference that we use when it comes to either athletes. Hopefully that makes sense.
And what are some common injuries you have come across in your career? Like you believe that athlete of any any sport you feel that this is one of the most common injuries that you have always witnessed as a doctor?
So it depends on the sport. So if you are looking at any plyometric sports, any sports that involves jumping, basketball, volleyball, the number one common injury in those sports is ankle sprains. That's because athletes have to jump, they have to land. There's so many bodies around them that a portion of the time they'll either land on somebody's ankle and then they'll roll their ankle type of thing. So ankle injuries and then soft tissue injuries, basically injuries to the muscles. Strains are the second most commonly injury among these sports. Most likely hamstrings is the first one. And then obviously you have the chronic issues. And the most common chronic issue that you have is some type of tendonitis. And usually in sports that involve jumping, there's an issue called jumper's knee, and that's the reason why it's called jumper's knee, is patella tendonitis, because that occurs. In contact sports, such as football, obviously concussions is the one injury, and then the other one would be their contusions, bruises, and possible dislocations of any of that sort type of thing.
So in your career, you would have come across a lot of cases where you would have to told the athlete to have some rest for a week, for a month, or maybe a couple of months. So what is your emotional state at that particular time? Because we know how much a sport means to that particular
Yeah.
athlete. And when you have to let them know, when you have to confront them that they cannot play a certain sport or do a certain activity, like what is the basic approach, the baseline approach of having this conversation with them?
Yeah, so this is kind of interesting that you bring that question up. It's not as easy as black and white. There's no like, hey, if this happens type of thing. The number one thing it comes down to is the athlete, him or herself, the type of athlete. There's, it's great when you work with athletes that understand their body. They've played around for so many years and they know, their limitations and their capacities, what they can do. And then, so those type of athletes tend to be very type A. They tend to be very competitive. They want to go out there. So oftentimes we as athletic trainers have to protect them from themselves in some case scenarios. Then you have other athletes that are very, how can I say, very fragile, very gentle. And those athletes, we have to not course, but actually motivate them to, hey, you're okay. You can go back out there and go out to the field type of thing. But to be honest with you, the interesting part about that, even when it comes to the type of injury, it always comes down to what we refer to as a risk reward. Okay. What is the risk of the athlete? So let's say an athlete has an ankle sprain and we have a game coming up. What is the risk of the athlete going and playing, and what is the reward? Okay. And the reason why I say this is, as the first person that pops in my mind is Kobe Bryant. I had the opportunity to work with him for about eight years. He's one of the most toughest, mentally tough players, physically tough players. Pain threshold is like off the roof type of thing for him. So it's very interesting. So oftentimes,
yeah.
Go ahead.
So can we say that you or other athlete trainers, doctors of this field, actually not only pertain their treatment to the physical rehabilitation but also to mental strength as well, like giving them all the mental, emotional and physical support and well-being?
Oh, 100%. And that's the part about it. It's like I said, as far as like what I mentioned at the beginning, is that as a role as the athletic trainer, it's evolved over the years, because we're not just a traditional, the old traditional, when you think of an athletic trainer, it's like, you tape an ankle and stretch a player and wait till somebody gets hurt. Nowadays it's a whole different involvement type of thing. I'll give you another different example. We had a player also with the Lakers that had torn his ACL about a year ago. And then, he's jumping and it's been a year. We've tested it. The ACL is great. He's fine. And, he tells me, and keep in mind, this player can jump really high. So he jumps up really high, gets up in the air, and he tells me stories like he's up in the air and he's like, wait a minute, I can't be this high. I cannot be this high because I have my knee, I got to come down. So he kind of comes down and he tells me stories like, Larry, your knee's fine. And over, there's been times where there was a game and at halftime you were running to the trainer. He was like, Marco, check my knee. I check his knee like, Larry, you're fine. It looks fine. Everything's fine. So yeah, there's a lot of emotional aspect, but that's normal part of the game. It's one of those things that a lot of people tend to forget, that athletes have emotions. And unfortunately, the old traditional way of as an athlete is, hey, just throw some dirt on it, suck it up, get out there and play. And to some extent, that might be an involvement, but athletes have emotions. They have to process an injury. They have to process through this whole type thing. And as the athletic trainer, you're there with them as far as helping them process that as well.
Okay, well, with this, Dr. Marco, I would like to introduce you to one of my segments of the show where we answer the question of my followers and patients. So, are you ready to
Sure,
answer these questions?
sure.
Okay, so the first question is coming from Kirti Arora from Ludhiana. Ludhiana is a place in India. She
Mhm.
says, hello, Dr. Marco, how are you? I'm an athlete. I want to know how do I increase my stamina a little more?
Her stamina.
Yes.
Okay. So that's the one thing about it, I guess you want to determine is that when you increase your stamina, you have to be kind of be sport specific. It's one of those things that you identify what kind of sport you're playing, what is the average distance that you're running, and what is the average time that you're going to be participating. For example, if you have a volleyball player and I'm going to have them do sprints, I'm only going to have them do sprints within that range of motion of the volleyball court. I'm not going to have them run 100-yard sprints because a volleyball player does not run 100-yard sprint in a game or anything of that sort. Um, and then same thing if it's a soccer or whether it's swimming, whether it's basketball or anything of that sort. So the first thing I do is identify, okay, what's the sport that you're playing? What is the average distance that you're going to be sprinting full speed? And then also low speed, meaning what's the distance you're going to be running sprints and what distance you're going to be just kind of jogging throughout the time. And then identify what is the average overall time that you're going to be participating in the sport. And then you make sure that you kind of jog or increase your cardiovascular. Because there's two different times. There's your cardiovascular and then there's your sprint time. So you want to determine which one you're going to work on.
Okay. I believe, Kirti, your question is answered. Next, moving on, we have Manveer Gujjar from New Delhi. He says, to be an athlete, is it important to be bulky or have six pack? I do not have six packs or abs. What body type is an ideal athletic body?
Okay, so that's a lot. That's a very nice, interesting question type of thing. So when it comes to athletes or anything in general, there's two types. I guess we narrowed it down to body types. There's the athletic individual and there's the aesthetic individual. Okay, so you have to identify an aesthetic individual. You work out to look good, to have the six pack, to have the chest, to have the biceps, to anything of that sort. That's the aesthetic. In athletic, you're not focused on the six pack. You're focused on injury prevention. You're focused on stability of your knees. You're focused stability on your back. Your stability.
The strength.
You're focused on a mobility, on strength type of thing, but not necessarily just strength. Because just because you can squat 300 pounds doesn't mean that's going to help you prevent injury. When it comes to this is the example I give everybody is that as an athlete, you want to have the fastest engine. You want to have the best tires. You want to have the best body work and look great. But one of the big issues a lot of people tend to forget, and this is where the injuries occur, is that oftentimes people forget about the braking system. So if you can have a nice Ferrari, you can have a nice Lamborghini, and you're going 100, 200 miles per hour, but when you hit that curve and your brakes do not work because you haven't focused on your braking system, you're going to wreck that vehicle. So as an athlete, when you look at injuries, majority of the injuries occur during the deceleration stage, during the braking system, hamstring injuries, during the deceleration, landing mechanics, deceleration, braking system. So if you don't work on these issues, and oftentimes when I have young kids or athletes and they go work with a strength coach, I ask them, do you work on your braking system? No, I'm working on jumping higher. And that's great. And the other thing you gotta think about, just like the law of gravity, what goes up must come down. And if you jump higher, because of gravity, you're going to come down a little bit harder. So you have to work on the braking system. So as an athlete, you want to focus more on the deceleration. Yes, focus on the strength, focus on that stuff, but it's more of the athletic type, not just aesthetic.
I believe this question was in everyone's mind and you have just cleared this. Well, moving on, we have Ria Arora from Mexico. She says, hello, Dr. Marco, how are you? What do you consider as some of the essential point an athlete should keep in mind before playing?
So number three things you want to look at as far as before playing. One, hydration. A lot of athletes forget about hydrating before a game, and they're concerned about during the game. They're concerned about either slightly, but hydration actually begins several hours before the game. So when I was with the Lakers, we had all our athletes. We had them on a full hydration customized program. We tested their sweat levels. We tested how much sodium they discharge, how much potassium discharge, and then we provided them with a hydration program. They actually started their hydration program. The game was like 7:30 p.m. Their hydration program began as early as 8 a.m. that same day, and also even afterwards. Nutrition obviously is one of the healthiest things, especially if you're a young athlete. You got to make sure you consume the proper nutrients, fluids that you're going to need to be able to kind of do that part. And then second and third, most importantly, make sure you create a proper pre-game activation program that's going to include some mobility in there, some stability and some activation before you kind of warm up. A lot of athletes do the traditional kind of just stretch, where you kind of just go ahead and lay on the ground and they stretch your hamstrings, stuff like that. But there's been plenty of studies that a more of a dynamic warm up, where you kind of get up and move, helps improve performance on whatever field you're doing.
Bingo, you have answered all the questions of my followers and patients well. Moving on, last but not the least, Dr. Marco, what do you think? Like, we have a lot of aspiring doctors and, people who actually make you their inspiration and they are looking forward to you in their career. So what do you feel some of the basic things or qualities an athletic trainer should encompasses? Like, what will be your message of wisdom and motivation and also inspiration to all other aspiring doctors of this field?
So, I mean, obviously, the first thing to begin with is actually educating yourself, understanding understanding the body, the anatomy, the kind of the science behind it. Obviously, that's the number one thing. You have to understand the science behind it, what it involves, getting your degree, all that stuff, and the part. But I think the other part that people tend to forget about an athletic trainer or just in sports medicine is the art behind it. There's science and the art. And the art is sometimes difficult to learn. It's more based on experience, and it's something that you have to understand your athlete. There's a saying every time I speak and I do presentations, I always finish with the saying, is that the athlete sometimes doesn't care what you know. They just want to know that you care about them. And it's about treating the individual, not just treating the injury. And I think as young athletic trainers, as young physicians, as young physical therapists, we're so concerned about, hey, I got to treat this ankle sprain, I got to treat this injury. But then you forget, hey, there's a whole individual over here that is either going through some discomfort, going through some emotional pain. They don't understand what's going on. And then as an individual, you need to explain to them. So oftentimes whenever I do rehab, I explain to them, okay, this is what we're doing. This is why we're doing it. This is a process. You will get here when we get here. There's milestones that we have to do. And then usually they have to say, okay, all right, I understand. This is what I got to accomplish in order to get to here, to get to here, to get to here. Because oftentimes as individuals, we have that information in our head and we're processing it. And they're just like, what are you doing? Why am I here? How long am I going to take? So the art, understanding the athlete, treating the individual, not just treating the injury, would probably be one of the things I would probably suggest or recommend.
Absolutely great. Well, thank you so much, Dr. Marco, for joining in. And yes, obviously discussing everything about this particular topic to me and my audience. I do hope you would have enjoyed it too.
I did. Thank you very, very much for having me.
Thank you so much. So, with this, we have come to an end of this energetic episode. This is your reminder to straighten your back, have a glass of water, and move. Okay, till then, take care. Goodbye. We'll see you in the next episode.
Thank you.